Next, random questions. What they want: diagnosis that fit best with this clinical picture. The clinical picture is a 71-year-old woman. She presents with tiredness, lethargy. GP previously noted that she was anemic. Commenced on iron therapy. Abdominal examination, remarkable investigation. White blood cell is low. Neutrophils are low. Lymphocytes are low. Monocytes, okay. Eosinophils are okay and also low. Basophils are low. Eosinophils are low, okay. Hemoglobin is low. Mean corpuscular volume is high. Okay, so platelet is low. So it has low level of most of the blood cell products. What does it mean? Bone marrow biopsy showed a increased cellularity. Is it a leukemia affecting the rest? But from MCV here, it's a good point here. You need to understand that this could be a result of folate deficiency. Is it acute myeloid leukemia, chronic myelodysplasia, myelofibrosis, increased cellularity. Is it acute myeloid leukemia? Now, in the older age, I would be keen to go for chronic CML, but in the CML, there will be increase in the neutrophils. So in this case, I'm keen to go toward, to be honest, myelodysplasia, because in myelofibrosis we have reduced cellularity. Okay, are you happy? Let's go. Yes, myelodysplasia is the correct answer. I'm happy that we were able to pick the correct answer. So myelodysplasia occurs mainly in the elderly. It presents with anemia, infection, bleeding due to pancytopenia. That's what we said. We've seen a reduction in all blood products, isn't it? So the serial blood counts show evidence of increasing bone marrow failure. Bone marrow showed increased cellularity. Patients with less than 5% blast in the bone marrow, these are managed conservatively. Gentle chemotherapy with high white blood cell count. Intensive chemotherapy reserved for patients under the age of 60. Okay, so there is a less than 5% in the bone marrow. They are managed conservatively. Those with high white blood cell counts is treated with chemotherapy, and those intensive chemotherapy is usually reserved for those under the age of 60. So there is the younger patients who are gonna get the intensive chemotherapy and the gentle chemotherapy, those with the high white blood cell count, and those with less 5 plus, there's conservative management. Transformation in a AML, this could happen in around 30% of patients. Okay, So this is the key point here. The key point we need to understand the pancytopenia, zotomelic dysplasia. Many dysplasia have three different types, either when there is less than 5%, those with less than 5%, then you treatment conservatively. Those who have a high white blood cell count, you treat them with a gentle chemotherapy, and those intensive chemotherapy for those under the age of 60. Okay, are you ready to go for the next question? What's the next question? The next question, our final question, is asking about the diagnosis and looks like an infection case, infectious diseases. Okay, 18-year-old woman, she's brought in emergency department, returning from a bank trip around South America. 2-day history of abdominal pain, persistent vomiting, fresh blood mixed in her vomit. Symptoms followed from a 4-day period of intermittent 4-day period of intermittent fevers, myalgia, headaches. Okay. Prior to this, she was well. No other past medical history. Examination's temperature is 37. Heart rate is high. It's regular. Blood pressure is okay. Respiratory rate is a bit high. Saturation okay. On auscultation, the chest sounds are clear. Heart sounds normal. Generalized abdominal tenderness, voluntary guarding in the epigastrum. Bowel sounds present. Widespread maculopapular rash. So the main thing, that is the abdominal pain, maculopapular rash, intermittent fevers, myalgia, headache. The rashes over her face, trunk and limbs, mild gum irritation, bleeding. So the gum bleeding means there is a problem with the platelets, isn't it? So it could be dengue fever or yellow fever. Now, the Nile fever, South America. Okay, so yellow fever, dengue fever, there is a platelets low affecting the gum. Both cases will be abdominal pain. There will be myalgia and headache and fever and rash. Now, which one is gonna get the rash? To be honest, I don't know. One of these two. I'm gonna go for dengue fever. And let's see. Yes, dengue fever is correct. Now, why? The patient has dengue fever spread by the Aedes aegypti mosquito. Is common in many areas of the world, including. Now, I know it's common in Asia, but it seems also common in South America. Now, the presence of fever, headache, myalgia, maculopapular rash, erythemas is common, along with facial flushing. Okay, so fever, headache, myalgia, maculopapular rash, and some the disease can progress to viral hemorrhagic fever, and dengue shock syndrome, severe cases. What is the treatment for this dengue thing? Supportive, the intravenous fluid, transfusion circle. So the dengue fever can cause hemorrhagic fever. When it becomes a severe disease, dengue shock syndrome severe cases. Now let's see how it's different from yellow fever. Yellow fever is a viral hemorrhagic illness spread by, so what is the difference? It's the Aedes mosquito, the same mosquito, and presents as mild flu-like illness followed by brief remission period before the onset of the hematemesis, jaundice, oliguria. So here the yellow fever affects the kidneys. Common in Central South America as well as Africa. The presenting symptoms of the question are milder than those of yellow fever. No mention of jaundice and oliguria, and only small amount of fresh blood mixed in the blood's vomit. While yellow fever should still be considered as differential diagnosis, the alternative diagnosis here should be considered. Presence of the maculopapular, for example, leans toward diagnosis of dengue fever, which is the correct answer. Okay, how many people were able to answer? Only 50%. People got mixed up with the yellow fever as well, is 15%, and 20% were saying B, Zika virus, for some reason. The same mosquito, Aedes aegypti, common in Africa, the Americas, Asia Pacific, short-lived illness, symptoms including fever, rash, erythroalgia, conjunctivitis, hemorrhagic symptoms are not seen in Zika, making it least likely diagnosis. Okay, so with these 3 questions, we finished our series for today. Let me know in the comments section if you need other types of questions being asked. Thank you very much. Goodbye.